Imagine a disease, right? Something that costs the global cattle industry nearly $1 billion a year. And often you don't even know it's there until it's really too late. Today, we're doing a deep dive into just that, anaplasmosis in cattle. And we've pulled together a whole stack of comprehensive guides and veterinary insights.
Yeah, our goal here is to really unpack this complex disease. It's often underestimated, but its impact on, animal welfare and just sheer production is huge. We want to arm you with the essential knowledge, everything from how it spreads so sneakily to how it's managed, basically get you quickly up to speed on this really critical topic.
Okay, so let's start at the beginning. What exactly is anaplasmosis?
Right. So at its core, it's an infectious disease. It's caused by a bacterium, Anaplasma marginale. And this little guy is an obligate intracellular bacterium, meaning it has to live inside cells, specifically red blood cells in cattle.
Okay, inside the red blood cells. And the main signs are things like anemia, fever, jaundice.
Exactly.
Yeah.
Severe anemia, fever, and jaundice. Those are the big three.
And you mentioned something important for telling it apart from other diseases.
Yes, absolutely crucial, especially for diagnosis. Unlike some other diseases that also handle red blood cells, anaplasmosis doesn't typically cause red or brown urine, hemoglobinuria. That's a really key differentiator veterinarians look for right away.
And why should our listeners, maybe not directly involved with cattle day to day, care about this?
Well, beyond the animal welfare aspect, which is significant, it's a massive economic drain. Think about it, nearly $1 billion globally each year. It's huge.
$1 billion. Wow.
Yeah, and over $300 million just in U.S. beef cattle annually. We're talking an average cost of something like $660 per clinical case. It just silently chips away at profitability.
Okay, so how does something microscopic cause such widespread havoc? The transmission must be complex.
It really is. It's a complex web. The primary culprits are what we call biological vectors. Ticks.
Ticks, right. I think most people associate ticks with livestock diseases.
Definitely. Specifically, dermacenter and rhipicephalus species are the main ones. But here's a fascinating kind of cunning part of it. It's the male ticks that are especially important vectors.
The males, why them specifically?
Because they can become persistently infected, unlike females who might clear it after feeding or laying eggs. And males move around a lot between cattle looking for females. So they act like these little mobile, constantly shedding reservoirs for the bacteria. It really helps the disease persist in a herd.
That's really interesting, a mobile reservoir. So vector control gets even trickier then. But it's not just ticks spreading it, is it?
Correct. You also have mechanical vectors. Think blood-sucking insects, horseflies, stable flies, even mosquitoes sometimes. They basically just pick up infected blood on their mouth parts and physically transfer it to the next animal they bite.
Like dirty needles almost?
Exactly like that. And some of these horseflies, believe it or not, can carry infected blood for up to 2 miles.
2 miles, wow. Okay.
Yeah, and this type of transmission usually peaks in late spring and early summer when those flies are most active.
So ticks, flies. What about us? Can humans actually play a role in spreading this?
Surprisingly, yes. And it's a critical point for prevention. Human-mediated transmission. It happens all the time, unfortunately.
How do we manage that?
It's through contaminated equipment during just, routine procedures. Needles are a big one. But also dehorners, ear taggers, castration knives, tattooing instruments, anything that gets contaminated with blood and isn't cleaned properly between animals.
So basic hygiene between animals is crucial then?
Absolutely critical. A key prevention measure is changing needles frequently. The recommendation is at least every 10 animals, ideally more often, and thoroughly cleaning and sanitizing all instruments between uses. It sounds simple, but it gets overlooked.
Okay, so the transmission network is pretty wide. What about unborn calves? Are they safe inside the mother?
Generally safer, but not entirely. While it's rarer, transplacental transmission, so from an infected mother to her calf in the womb, is possible. And interestingly, the colostrum, the mother's first milk with antibodies, it doesn't seem to boost the calf's natural resistance enough. So getting those antibodies won't prevent the calf from potentially becoming a carrier itself later on.
Which brings us to these carrier animals. You mentioned them briefly. Tell us more about their role.
Right. The carriers are absolutely central to understanding anaplasmosis. These are cattle that survive the acute initial infection. They get better, clinically speaking, but they become persistently infected, often for life. They usually show no clinical signs. They look perfectly healthy.
So they're like silent spreaders.
Exactly. They are the principal source, the main reservoir for the infection. They're constantly there, enabling transmission to susceptible animals whenever a tick or a fly or a dirty needle comes along. This persistence, this carrier state, is a core feature of the disease's epidemiology.
So you have these hidden carriers. What does that mean for different ages of cattle? Does it affect them all the same way?
Ah, that's a great question. And it leads to this sort of epidemiological paradox. It's fascinating, really. Young calves, say under a year old, they're usually asymptomatic or they only show really mild signs if they get infected. But here's the kicker. They invariably become lifelong carriers.
So the young ones survive easily but keep the disease going.
Precisely. Now, contrast that with adult cattle, especially those over 2 or 3 years old. If they get infected for the first time as adults, they get hit hard. They are severely affected, and mortality rates can be as high as 30 to 50% if they aren't treated promptly.
Wow, 30 to 50%. That's devastating.
It is. So this age-dependent severity is a fundamental risk factor at the herd level. It shapes how the disease moves through a population. The fact that calves survive easily and become carriers actually ensures the bacterium's long-term survival. It's a very effective strategy from the bacterium's perspective.
Okay, let's dive a bit deeper then. Inside the animal, once Anaplasma marginale gets into those red blood cells, what's actually happening? What's the progression?
Right. So the bacterium multiplies inside the red blood cells. The host's immune system eventually recognizes these infected cells as abnormal and starts destroying them.
Ah, so the anemia is caused by the body's own immune response.
Largely, yes, it's clearing out the infected cells, but the consequence is anemia. The incubation period, the time from infection to signs, can vary a lot. Anywhere from, say, 7 days to 60 days, sometimes even up to 100 days. Clinical signs might start to appear when only about 1% of red blood cells are infected, but you usually see the really obvious overt signs when 50% or more are destroyed.
50%. No wonder it's so severe.
Exactly. And by the time you see those really dramatic clinical signs, the disease is already progressing very rapidly. It's in a critical state. That explains why sometimes sudden death is the very first thing a producer notices. The animal seemed fine yesterday, and today it's gone.
Okay, so given it can progress that fast, what are the absolute earliest warning signs someone should be vigilant for?
Good question. Initially, you'll often see a fever. Quite high, maybe 103 to 106 degrees Fahrenheit. Then loss of appetite, the animal just goes off feeds. Lethargy, weakness. And in dairy cows, a very rapid drop in milk production is a big clue.
What about visible signs?
Pale mucous membranes, that's a key early indicator of the anemia. You can check easily in the vulva or the sclera, the white of the eye, or inside the mouth. They'll look pale, whitish instead of pink. Rapid weight loss is also common.
And you said it progresses quickly once those signs appear?
Yes, very quickly. If the animal manages to survive those first few critical days, the mucous membranes often become distinctly yellowish. That's icterus or jaundice. It means the liver is struggling to process all the breakdown products from the red blood cells.
Okay, so paleness first, then yellowing.
Right. And because of the severe anemia, there's oxygen deprivation, especially to the brain. This can cause some weird behavioral signs, aggression, excitement, disorientation. They just aren't themselves. You'll also see labored breathing, a really fast heart rate, fast respiratory rate, as the body desperately tries to compensate for the lack of oxygen. That period, about 4 to 9 days after the clinical signs first show up, is really, really critical. Survival often hangs in the balance there.
And just to hammer this home again, that key thing you don't usually see.
Right, no red or brown urine. The consistent absence of hemoglobinemia and hemoglobinuria, it's vital for differentiating it from something like babesiosis, which is often called red water, precisely because it causes red urine. Anaplasmosis typically doesn't.
What about pregnant cows? Are they at higher risk?
They are, unfortunately. Pregnant cows are especially vulnerable. The severe anemia and the oxygen deprivation that comes with it can easily lead to abortion.
Oh.
Yeah, especially if they get infected later in gestation. It's a major cause of reproductive loss in affected herds.
And just circling back to those carrier animals for a sec, the asymptomatic ones, normally they show no signs and they're immune to getting acutely sick again. However,
There's always a however, isn't there?
hey, seems like it. They can relapse. If their immune system gets compromised for some reason, say, they're treated with corticosteroids for another issue, or they get hit with another severe infection, the anaplasma can flare up and they can actually show clinical signs again.
And if, sadly, an animal doesn't make it, if you were doing a post-mortem exam, what would you expect to find?
The main things you'd see are signs of that massive red blood cell destruction. So marked anemia, the tissues would look pale, and jaundice, that yellow tinge everywhere. The spleen is almost always characteristically enlarged and very soft, kind of pulpy. The liver might also be enlarged, maybe look mottled and yellowish. and the gallbladder is often distended with thick, dark, sludgy bile. It all points back to that breakdown of red cells. Okay, so let's say a producer or a vet suspects anaplasmosis based on these signs. How do they actually confirm it? What's the detective work involved?
Diagnosis really relies on putting together a few pieces. First, the clinical suspicion, seeing that anemia, the icterus, maybe the fever, and crucially not seeing red urine. That gets you thinking anaplasmosis. But then you absolutely need laboratory confirmation. You can't rely on signs alone.
What are the main tools in the lab for that confirmation?
Well, for an animal that's acutely sick, showing obvious signs, the parasitemia, the number of bacteria in the blood, is usually high. So the most common first step is microscopic examination of a blood smear. You stain it with gene stain and look under the microscope.
What are you looking for?
You're looking for the actual anaplasma organisms. They appear as small, round, kind of dark blue or purple dots, usually right at the edge, the margin of the red blood cells. That's why it's called Anaplasma marginale.
Ah, okay, makes sense.
But this method, looking at smears, it's great for acute cases, but it's not very sensitive for picking up those low-level infections in the carrier animals. The bacteria are just too few and far between.
So how do you find the carriers then? The hidden ones?
That's where serological tests come in. Tests that look for antibodies the animal has produced against the bacteria. The most common and reliable one is called the competitive ELISA, or SALISA. It's highly sensitive and specific, meaning it's good at finding positive animals and correctly identifying negative ones. It detects antibodies against a specific protein on the surface of the anaplasma, called MSP5, and the results can come back pretty quickly.
Okay, so blood smears for sick animals, ELISA for finding carriers. Is there anything even more precise?
Yes. For the highest sensitivity, especially for detecting very low levels of infection in carriers, or even detecting the bacteria in the ticks themselves, molecular techniques are the way to go. We're talking about PCR polymerase chain reaction, specifically real-time PCR or qPCR.
And that looks for the bacteria's DNA.
Exactly. It directly detects the anaplasma DNA.
Yep.
It's incredibly sensitive. qPCR can even be set up to differentiate between different anaplasma species, which can be useful sometimes depending on the region and what else might be around. So the important thing when you're thinking about diagnosis is choosing the right test for the job. Blood smears are good for sick animals right now. But if you want to know who the carriers are in your herd, you really need serology like the SALISA or the high-sensitivity PCR tests. They're the gold standard for finding those hidden reservoirs.
Right. Okay, so you've got a diagnosis. What can actually be done? How do you treat affected animals and maybe try to control the spread in the herd?
Treatment primarily comes down to antibiotics, specifically the tetracycline class. Oxytetracycline is the main one used. For those acute, really sick animals showing symptoms, getting injectable oxytetracycline into them promptly is absolutely crucial for survival, especially if you catch it early before too many red cells are destroyed.
Makes sense for the sick ones. But what about managing those carriers? The ones that look fine but are spreading it, can you treat them?
You can. For managing carriers, you can use chlortetracycline, another tetracycline, often given mixed in the feed over a longer period. There's even a strategy called chemosterilization. This involves using higher doses of chlortetracycline for a prolonged time, and it can actually clear the organism completely from the carrier animal.
Chemosterilization. That sounds like the ideal solution, right? Like get rid of the carriers entirely.
It sounds ideal, but here's the major catch. It comes with a really significant downside.
Oh, what's that?
When you clear the organism completely, the animal also loses its protective immunity. It's no longer a carrier, but it's now fully susceptible again.
Ah, so if it gets reinfected.
It can get severely sick, just like an adult animal that had never been infected before. So it creates this real dilemma for producers. Do you clear the carriers and risk severe disease if they get exposed again, or do you leave them as carriers? And this is especially tricky now with increasing pressure to reduce antibiotic use in livestock. Long-term feeding of antibiotics is under a lot of scrutiny.
That is a tough spot. Okay, so besides antibiotics, what about supportive care for the really sick ones?
Oh, absolutely critical. Severely anemic animals are incredibly susceptible to stress. Any extra exertion can push them over the edge. So minimizing handling is paramount. Keep them quiet in a low-stress environment with easy access to food and water. Just let them rest and recover. And for really valuable animals, or ones that are severely anemic, blood transfusions can make a huge difference in survival rates. It's resource intensive, obviously, but it can be life-saving.
Okay, that covers treatment. What about the bigger picture, preventing this across the whole herd in the first place?
Yeah, prevention needs a multi-pronged approach. There's no single magic bullet. Vaccination is one piece of the puzzle. In the U.S., there is a killed Anaplasma marginale vaccine available. It's often regulated as an experimental or state-specific product.
Does it work well?
It helps. It's shown to reduce the severity of clinical signs and reduce deaths if animals do get infected. But, and this is a big but, it does not prevent infection itself, and crucially, it does not prevent the establishment of the carrier state.
So vaccinated animals can still become silent carriers?
Exactly. They might not get as sick, but they can still get infected, become carriers, and contribute to the spread. So it's a tool, but not a complete solution.
Okay, so if the vaccine isn't foolproof, what else is in the prevention toolbox?
Vector control is absolutely key. Since ticks and flies are major spreaders, you need strategies to reduce them. That means things like regular use of acaricides products that kill ticks and mites. Proper pasture management can help too, keeping grass shorter, removing brushy areas where ticks like to hang out, and reducing fly breeding habitats through good sanitation, managing manure, and so on.
Makes sense. Attack the vectors.
Right. And alongside that, stringent biosecurity measures are essential, especially when bringing new animals into the herd. Ideally, source animals from herds known to be free of anaplasmosis. If that's not possible, test new arrivals before introducing them. Don't bring in unknown carriers.
And what about that human factor we talked about earlier, the needles and instruments?
Yes, reinforcing that is crucial for prevention. Preventing the reuse of blood-contaminated equipment is non-negotiable. Consistently changing needles, that rule of thumb, at least every 10 animals, or even between each animal if feasible. And thoroughly cleaning and sanitizing all surgical instruments, like dehorners or castration knives, between every single use. These practices can dramatically reduce transmission risk.
Wow. Okay, so we've really covered a lot of ground here on anaplasmosis in cattle. We went from, how it spreads so stealthily through ticks and flies and even our own equipment.
Yeah, and the really critical role of those asymptomatic carriers, the ones that look healthy but keep the disease going.
Right, and its huge economic impact. Plus the complexities of diagnosis, treatment options like tetracyclines, and all the control strategies from vector control to vaccines that don't quite stop the carrier state.
And we really saw how differently it hits animals based on age. Those young calves often just become silent lifelong carriers, while the older cattle face this really severe, potentially fatal illness. It just highlights how insidious that carrier state is. It's often overlooked, but it's absolutely central to why this disease persists and why it's so challenging to manage effectively.
Absolutely. Which, brings us to a final thought, something provocative maybe for you, our listener, to chew on. Given everything we've discussed, especially that young calves often become carriers without getting severely sick, and that our current vaccines don't actually prevent that carrier state, how should our focus maybe shift in managing herd health? Is the ultimate goal really total eradication, which seems incredibly difficult with these silent carriers? Or is it maybe a more nuanced approach, perhaps focusing on just minimizing the economic losses and maintaining overall herd health, even with the presence of these carriers? What does that really mean for how we even perceive a healthy herd when facing such a persistent, often hidden threat like anaplasmosis? Something to think about.